My name is Kenzie. I'm going to be your nurse today. How are you feeling today?
Good.
Any pain?
No.
Okay. Can you tell me your age?
20.
Okay, so 20, Caucasian female. Seems to be healthy. Can you tell me your weight?
170.
And your height?
5'11".
Okay. Looks like you have a BMI of 24. Okay. Looks to be dressing, hygiene, and grooming seems to be good. Patient denies having any pain. Behavior seems cooperative. Thought pattern seems to be logical, relevant, and organized. The patient is alert. Speech is articulate. Can you tell me your full name?
Chessa Jean Cunningham.
And where are you?
Your dad's house.
And how about what day of the week is it?
Tuesday.
Okay. So patient is oriented as well. For the intellectual capacity, can you tell me who the president was before President Trump?
Obama.
Okay. And can you remember what my name was?
Kenzie.
And when people say an apple a day keeps the doctor away, what is meant by that? What do you take it as?
Just an apple a day keeps you healthy.
Okay. And for judgment, if it were snowing outside and you were to go outside, what would you do to prepare?
Just put on some warm clothes.
Alright, I'm going to take your vitals now. You said no pain?
No pain.
Okay. I would normally take temperature, but I don't have a thermometer. But before class this morning, my temperature was 97.2, so we're going to go with that one. I'm going to grab your pulse. Okay, your pulse is at 82, respirations are at 16, which is normal. Alright, and then we're going to grab your blood pressure. Do you know what your blood pressure normally runs?
It's usually normal.
Okay. I'm going to be doing the one-step method. Okay, blood pressure is about 116/80, which is normal. And you don't have any dizziness or feeling like you're going to pass out?
Nope.
Alright, I'm now going to be assessing the lungs and thorax. Looking anteriorly, looks like everything's symmetrical. The color, temperature, and moisture are normal. Okay. I'm going to palpate our clavicle. And then down the sternum. Everything seems to be symmetrical. Let's check respiratory excursion. I'm gonna have you turn your head. Turn your head. I'm gonna place my hands at the bottom of the lungs. Now take a deep breath. Yeah, release. Okay. Respiratory excursion seems deep and symmetrical. And now laterally, and then lift up your shirt. Okay. Skin has good color, negative for lesions. I'm going to go posteriorly. Posteriorly, I'm just going to lift up the gown a little bit. Skin is the appropriate flesh tone, negative for lesions. I'm going to look at her scapula. Seem to be symmetrical. I'm going to palpate the spine. Spine seems to be symmetrical. Look at the S curvature. Height. Seems to be good. Appropriate S curvature of the spine. Then I'm going to do another respiratory excursion. Again, I'm just going to have my hands at the base of the lungs. Go ahead and take a deep breath. Release. Respiratory excursion is good on the posterior side. And now I'm going to check your AP versus transverse diameter. I'm going to place my hand on the front of the pectoral muscle here and here. AP transverse diameter is about half, which is appropriate, and means that the patient is negative for barrel chest. Okay, now I'm going to auscultate the lungs on the anterior side. I'm going to have you take deep breaths, but no faster than normal. Okay. You can go ahead. Okay. Breath sounds on the anterior side. Rate was consistent with vitals. Rhythm was regular. Depth was deep because I asked her to breathe deeply. Effort was unlabored. Negative use of accessories, and they were negative adventitious breath sounds with vesicular breath sounds all the way down through, which is... Now I'm going to auscultate the posterior side of the lungs, starting at the C7 sinus process. For this, to separate your scapula, I'm going to have you give yourself a half hug like this. Okay. You're going to breathe deep, but no faster than normal. Go ahead whenever you're ready. okay. Same as the anterior side. Her rate was regular with vitals. Rhythm was regular. Effort was unlabored. She was again negative for the use of accessories and adventitious breath sounds with vesicular sounds all the way down. Cardiac assessment, I'm going to check the patient for any heaves or lifts. Patient is negative for any heaves or lifts. I'm not going to palpate intercostal spaces. Check for any pulsations or thrills. We'll start at the angle 3, down. Second rib, second intercostal space. The aortic region. Need for pulsations and thrills. Through the pulmonic. Negative for pulsations, thrills. Third rib, third intercostal space. Negative for thrills and pulsations. Fourth rib, fourth intercostal space. Negative for pulsations and thrills. And here at the tricuspid, at the fifth intercostal space. Negative for pulsations and thrills. And then over at the mitral, there is faint tapping at the apex of the heart, which is normal. Okay, so location is the fifth intercostal space, midclavicular line. Rate is regular with vital signs. Rhythm is steady. Intensity is strong. Diameter, it doesn't go anywhere else besides the fifth intercostal space, which is normal. Duration is appropriate and it's just a faint tapping. With the cardiac assessment, I'm not going to auscultate. Heart sounds, I'm going to go through 3 times. The first time just to identify the relationship between S1 and S2. At the aortic oscillatory site, S2 should be louder than S1, and then once we get down to the mitral site, then S1 should be louder than S2. When I go through the second time, I'm just going to be looking for loud pitch, murmurs, splits, clicks, things like that. And then the third time, I'm going to be looking for low pitch, extra heart sounds. Okay, so at the angle, space, aortic. Sounds strong and regular. Moving to the pulmonic. On the Erb's point. Fourth intercostal. Fifth intercostal, or the tricuspid. I'm going to take a half step. And then over to the mitral. And I did get the appropriate heart sounds at the aortic. S2 was louder than S1, and at the mitral, S1 was louder than S2. Now I'm going to go back up and look for any high pitch extra heart sounds, starting at the mitral. And tricuspid. Fourth intercostal. Herbs point. Second intercostal. Colonic, and then the aortic. Okay, negative for any high-pitched extra heart sounds, and I'm going to use the bell of the stethoscope and look for any low-pitched. The aortic. Colonic. Herbs point. Fourth intercostal, tricuspid, then a half step, and then the mitral. Okay, which was also negative for any low-pitched extra heart sounds. Okay, lastly, to finish up the cardiac assessment, I'm going to percuss the cardiac silhouette. To do this, I'm going to take my little finger, sternal notch, Louis. Okay, and the cardiac silhouette is good. Appropriate sounds from the outside come from resonance to the sternal border. You get dullness, and then back to resonance, which is normal.